Hello, everyone. Welcome to Play It By Ear, where the more we know, the more you grow. Welcome to episode 4, where we'll be talking about technology and the innovation of healthcare, and how healthcare has really changed in our lifetimes and how it might change in the future. So, today I'm joined with Arjun and
Hello.
Namitha.
Hi everyone.
And yeah, so I think we'll get right into it. So, I think the reason we chose this topic was like, we know that technology is coming so fast in like what is being innovated in the NHS itself right now, which is why we thought, okay, let's get our thoughts onto a podcast, see what we think, and see what medicine can be like after we come out of medical school in like 5 or 6 years time. So yeah, looking back, how has the healthcare industry really changed in the last 10 years? Do you think? Like, what do you think?
I think there's so much that we can talk about when it comes to how has the healthcare industry changed. I feel like the resources and the tools that we have itself to carry out research have become so much more accurate and even like complex, so that our means of like figuring out new methods of care or new efficient ways to sort of handle things in healthcare has become so much better. In fact, I think I recently read a statistic to do with medical knowledge that's like it was estimated a few years ago that by 2020 medical knowledge was supposed to double every 73 days.
Jeez.
Now, obviously, I don't know how true that is now, but it was like an extrapolated value, but it kind of shows how much we know now and how quickly research is being published. So with that, there's obviously so many things that would be innovated. So yeah,
Hmm.
it's crazy how fast it's changing.
I think tech in general is something that's like been really quick to what coming into the social sphere of things. Like if you think about it,
Mm.
10, 15 years ago when we were younger, we were interacting with like big TVs, like big boxes, and now we have
Oh
just
yeah,
like
sure.
really thin laptops that can do the same thing and even more in just a matter of like 10, 15 years that we've come this far. So
Hmm.
if we're looking back into like medicine in itself, I think it's really accelerated. If you think about from how it used to be before, and before COVID especially, when we were looking at the old electronic health records and the old operating system that the NHS was using. I remember that was a big problem before. But I think recently we've been able to accelerate quite fast in moving towards a new technologically sound NHS. I mean, what do you think
Hmm.
about healthcare, Arjun?
So, yeah, it's definitely improved over the last 10 to 15 years, especially with remote monitoring. So, remote monitoring allows patients and their progress to be monitored at all times by using probably apps that the patients can download in their own devices. Not only does that mean that doctors and nurses are able to help them, but they're all also able to gather data much more efficiently and quickly and store them in much smaller storage devices, whereas in before they would need huge servers to allocate these data.
Hmm.
So this creates a more comfortable and cheaper experience for everyone involved. During my work experience, probably a year or two ago, I had the opportunity to observe the workings of an antenatal clinic. So this clinic clinic's main focus of healthcare was revolved around pregnant patients, and while I was there, I was told about this system called Sentinel Health, and it monitors like various conditions of the patients, but there's a specific app called GDM Health, and this helps monitor the uh, blood glucose in gestational diabetes.
Hmm.
So, with this kind of advancement in remote monitoring, medical experts are able to make more better and rapid clinical decisions.
Yeah.
That's actually really useful because I'd say that, like, particularly what you just said, like with pregnant patients or elderly patients, and they're quite vulnerable, and at sudden times they can have quite like acute health problems. and it's really good to have things that monitor them like that.
Mm.
Like I think I also read about this sort of device that helps elderly patients. It's like almost an alarm clock that tells you to take your medication, and so it's so like useful now that we have things like that, because especially for people like, that are elderly, that don't have anyone with them, or if they're not in social care, it's just so difficult to manage in that sense. But then you could also argue the other point as, are they going to be able to use technology, because that must be something that's quite
Mm.
difficult to adjust to.
Mm.
So yeah, I don't know what you think about that. How do we manage that?
Yeah, that was something I was thinking about when I was talking about the old operating system of the NHS going towards the new operating system. Like we all know the healthcare pathway in itself takes so long. So usually the most experienced doctors are a lot older than what the younger doctors are, and many of them being junior doctors. And it makes me think about like them having to adapt to technology in itself, something that they've never had to do before.
Mm.
Whereas we see kids nowadays automatically using iPads and phones just because they've been exposed to that kind of lifestyle. So yeah, I think it's difficult, but it's something that is only relevant in our recent times. I feel like in a few years' time, it will go to a level where everyone has some kind of experience with technology, don't you think? I
Mhm.
mean, another thing that I was thinking about when Arjun mentioned gestational diabetes was like the management of type 1 diabetes. I remember my great uncle, right, or one of my relatives, he has type 1 diabetes, and essentially he used to use insulin injections and um, very various different forms of management for his diabetes, and generally he found that it was very difficult for him to keep in a sanitary area, because obviously you need to be sanitary to obviously do injections to yourself. But recently now we've seen like these pumps, right, that people with diabetes just put on their arms, and they can control their sugar glucose just from the glucose in their blood just from their phone, which is revolutionary. Like, yeah, I mean, another thing that you could talk about is like hacking, no?
Yeah, I was just going to
Mhm.
bring that up because, as you said, insulin pumps. There's this company I read about a couple days ago. I think it's called Medtronic or something. And 2 years, 2019, it was they had a bit of an issue where they had to recall some of their products that they had sent out, because they'd realized there was a massive like fault in their product, which allowed insulin pumps and pacemakers to be hacked.
Hmm.
And just thinking about that is so scary, because someone's like pacemaker, someone's insulin pumps, these are things that they rely on a day-to-day basis, on a minute-to-minute basis. And if those were to be hacked, I don't really understand the intention of why someone would.
Hmm.
But things like that are a real risk. And sometimes you just think it's so unnecessary when you could stick to traditional methods where you wouldn't have such an issue.
Hmm.
So yeah, that's a real problem, I think.
Hmm. I mean, we can shift towards like I was thinking about hacking in itself. Do you think like technology itself will become so advanced where we can replace like vital organs and then those themselves can be hacked? So assassination attempts can simply just be a hacking attempt, don't you think?
Mm.
Seems very sci-fi to me, but it's something that realistically could happen in the next few
Yeah,
years.
at the pace at which we're going now, I wouldn't be surprised if that became a thing, like obviously within our lifetime, I would say that that seems like quite probable, which is scary, very scary.
Hmm. Okay, let's talk about like an advancement in technology, right? What has like catalyzed technology? It's obviously the pandemic that's pushed us
Yeah,
into
100%.
using it more. I mean, what have your experiences been with like technology and its implementation in the pandemic itself? It doesn't have to be medical. Like, what other things have you seen being improving because of the pandemic? Arjun?
Mm. So I haven't seen anything like that, but I've read up on some websites saying about AI and robots. So there's this thing. technology called vocal biomarkers. So AI is developing to at such a fast rate that it's able to be implemented into recognizing certain characteristics in a person's voice, and it'll use certain algorithms and data patterns to figure out what conditions this patient has, and using this data and everything, it's able to send it back to medical experts for them to work on treatments for the patient. So. Uh, an example of this is Sonafi, which is a US-based startup and is focusing on a voice-based screening app that will look for vocal features related to the presence of COVID-19.
Mm.
Yeah, so it's been improved.
So just based off like listening to the voice,
Mm-hmm.
you can determine
Yeah,
if someone has COVID. Wow.
yeah,
Okay.
it's quite interesting.
Hmm. Yeah, I think some of the issues that we were sort of having in relation to COVID, the main way to solve those was through technology, because obviously face-to-face interaction had to completely be, abandoned. So the only other way that we have is sort of virtual interaction. And I think there are a few things with that that were definitely helped alongside. So, for example, we had a major PPE shortage in the first
Mm.
lockdown. So, the main aim was to try and minimize the amount of people that were coming into the hospitals to not only protect the healthcare workers, but also the patients themselves. So, I've recently been reading a lot about virtual reality in medicine and augmented reality in medicine. And there was this scenario of a COVID positive patient whereby there was only one doctor who was able to go into the operating theater because he had a separate issue. It wasn't related to COVID, but because he was tested positive, they had to minimize the amount of doctors that were actually present. So there was one doctor there doing the surgery, and then there was about 4 or 5 in another city that were using a platform to watch the surgery and then sort of help assist the person through AR, and it's basically like almost 3D modeling and figuring out how to like superimpose on top of the surgery. So that was incredible because you've not only minimized like you've not only helped the patient in terms of like it's more accurate care, it's assisted by the multidisciplinary team and all of that, but at the same time you're protecting them from COVID, you're protecting from PPE shortage. So there's so many benefits that came out of it that like from the pandemic alongside of that. So yeah, obviously I think the pandemic was like the main accelerator for like technological change in medicine. I would say
Mm.
before that, not so much, but it was definitely the main sort of
I
click that we needed.
I had a very strange thought while you were speaking about that. Like, you were saying that technology itself has been accessible from other places around the world geographically, right?
Yeah.
So, does that mean doctors who might be on holiday or might be sick, let's say,
Hmm.
they can be asked by the healthcare services to do surgery or something remotely from their home simply because we have the technology that's available to them? Do you think it's like it could impede on the work-life balance of a doctor?
I mean, like technically and practically that could work. If we have the technology, yes, anyone from another country and city can access it if you have that kind of technology. But again, like you said, I don't think that would necessarily be implemented because the like mental health and the work-life balance of the doctors has to be prioritized. And so I don't see them working when they're on holiday or working when they're sick because you can't do that. Like if you don't let doctors have a break, their performance is obviously going to be hindered when they come back from their break.
Mm-hmm.
So practically, yes, that could happen, but ethically, I don't think it would be.
Mm.
Yeah.
Okay. Yeah. I mean, we've talked about like really advanced technology right now, but I think
Mm,
also on the same kind of levels, technology that are quite basic for the public to use is something that the NHS and healthcare services have been implementing. I think a lot of our listeners might have, before clicking onto this, might have come up across an ad which says "Stop the spread" or stop the transmission or something like that, which is about the government trying to en- encourage people to do more negative tests for COVID-19, which is something that I've never seen really happen at this kind of scale. Don't you think? Like we've been putting these messages all over. Every time you go outside, you see something like that, and that's partly
Mhm.
due to the technology that we have right now. Would you say?
Yeah. So that's like the whole social media aspect and public health campaigns aspect, which I'd say like technology and media is the best platform to get through to patients and just the public in general these days, especially with the pandemic. So I would say, yeah, that's definitely an aspect to be considered because it is technology, slightly different way of approaching it though. Yeah. So Arjun, what would you say about that?
So
Are you okay?
said
Side?
brain freeze.
Brain freeze. Yeah, we're just talking about like how technology has like changed through the pandemic on like every single scale, from like minute operations to the whole public health scheme. I mean,
Hmm.
how do you think, Arjun, that your life as a doctor might change because of innovations in technology?
So yeah, I think doctors in general, their their lives would change as well with the rapid ongoing of technology. So, for example, telemedicine has been there before the pandemic, and it's been more heavily promoted during the pandemic as government officials would try to promote the
Promote people to like stay at home and yeah, get
yeah. So
Hmm.
mm, and get
I think
yeah.
also there's the whole aspect of like they're trying to avoid people having access to misinformation.
Mm,
So the more that they put out that's from accurate sources such as the NHS, from scientists, from accurate publications, the more content that's reliable that is being put out, the less likely people are to see things from, a very narrow rabbit hole in YouTube about something that's completely, a conspiracy that's been made up. Because, for example, if you go onto YouTube now, you'll have like a window or sort of a carousel of just NHS promoted videos about the pandemic, about the vaccination program. It's like the first thing that you'll see as soon as you come onto YouTube because they're trying to make sure that the accurate information is more accessible than the, other theories out there.
mm,
So that's something that's really important that needs to be, monitored and sort of policed very well. Is as we keep going with like technological advancement, there's so much that the user could be exposed to
mm,
that we should try to limit. I think another thing would be like addiction as well
ooh.
to certain like technological aspects. I don't know if you guys know anything about that. How do you feel about people getting addicted to sort of the technology the more and more it's implemented? Like, say, if it's even implemented in their healthcare.
I'm not sure how that would come about. Maybe like let's say in mental health when they're using virtual reality. Do you think I'm not sure whether patients themselves would be addicted to like coming to the hospital regularly just so they can experience the mental health, uh, the virtual reality experience in terms of addiction, because I feel like
Hmm.
most of what technology addiction that we have right now is because of the stimulating aspects of technology. For example, like a lot of addiction stems from gaming, stems from social media, things that ver- captivate your brain for every 10 seconds that you scroll on an Instagram reel or TikTok. You are you are entertained, and that's
Hmm.
essentially what makes it addicting. So I don't really know whether healthcare technology can be seen through the same lens, because I don't think in at least from a personal point of view, I don't know if I'd when experiencing healthcare would want to keep going back to it simply because it's online. I don't it there's not the same level of entertainment for that. Mm,
Okay. Yeah,
yeah.
that's a fair point.
Um, you also talked about research, which I think was an important thing that we should touch on because
Yeah.
uh, research it should be policed very heavily. But I think a lot of us in our interviews have talked about how we want to engage in research as a doctor later on in our lives and what we want to do. Like I've done an EPQ on artificial intelligence and machine learning, and Nam, you've done your research on virtual reality. But
Hmm.
it makes me think like doctors, they're not just there to do research and also help patients, but they've got so many other roles. So realistically, do you think all doctors really need to do research, or is it is it that fundamental? Arjun?
Yeah, it depends, but yeah, Arjun, what do you think?
So I feel like doctors definitely should do some research to provide better insight into like treatments and further innovations of technology, but I think there should be some sort of cap on how many researchers that should be working.
Hmm.
Definitely. So
Yeah, because this is a discussion we've had previously, is about sort of too much research being put out to the point where it just becomes oversaturated, and there's too much information out there to work with. So that is definitely one aspect. But I think, to answer your question, doctors should definitely keep in touch with research and like stay on top of information that's being put out. Not everyone has to be doing a research project and having multiple publications. Those are two separate things, because obviously you need evidence-based medicine.
Hmm.
So we need some evidence to be working with. And but at the same time, we don't constantly need to be, churning out uh, new publications about everything under the sun.
Hmm.
But there are some areas that I feel are sort of underrepresented in research, very niche areas of medicine. And so if people were to focus more on those areas, then we'd sort of be broadening our horizons, and that would be more efficient than just researching the same thing that's already we've already got tons of information on.
Hmm.
Maybe that could be a way to solve this problem.
Yeah. No, I think that's insightful.
Hmm.
Research in niche areas, like obviously I think one of the biggest areas that research is being conducted in is like cancer and the
Yeah.
treatment of cancer. I'm personally right now interested in becoming an oncologist. Obviously, I don't know what I'll be in the future, but um, having like research into different forms of cancer therapies, I can see that there's a lot more focus onto using the different forms of radiology in trying to not only detect cancer better, but also cure cancer through like um, non-invasive procedures such as proton beam therapy, which I guess
Hmm.
is a technology in itself that can be improved. So I think this is all like touching on the area of like streamlining the NHS, which is something the NHS has been trying to do through their 10-year plan. I mean, if you were in charge of streamlining the NHS, what do you think you would do to make it more streamlined? Either of
Hmm.
you, I'm not sure.
Um, would you mind explaining what you mean by streamlining the NHS?
Yeah, so like there's a lot of unnecessary content and used when scanning, for example, but also like we have this huge waiting list through COVID, where patients who have elective procedures they need to be seen, and they maybe have waiting times of over a year. So in that sense, the NHS is kind of lagging behind, and I think that
Mm.
could be improved by improving the speed and hasteness of everything that the NHS provides right now. And obviously, the biggest problem here is the problem with there not being enough beds, which is something that the
Yeah.
NHS can be looking into when innovating it. So I don't know. What do you guys think should be done to alleviate those issues or improve them?
Okay.
Mm.
I guess I have a few ideas. So I think it's about sort of trying to minimize the amount of like acute serious cases that are coming into the hospital, because those are obviously the ones that you have to attend to
Hmm.
and treat. But then there's also ones that you can prevent from happening, or you can sort of direct into other like forms. So for example, social care or like mental health, these are sort of ones that you can uh, improve so that you can minimize the amount that come into like main hospitals kind of thing.
Hmm.
And so that's all to do with preventative medicine, which is like a whole new aspect of like modern medicine. So of course we have technology in modern medicine, but we also have sort of preventative care. So like we've been talking about, healthcare campaigns, improved social care, and alongside that, technology will sort of come together and help the NHS mainstream or like prioritize their main issues, I think.
Mm.
So it's kind of just about allocating your resources wisely, basically.
Yeah, I mean, you touched on social care, but there's something that I've
Yeah.
seen recently is like the implementation of robotics into whole different forms of healthcare. For example, pharmaceuticals. I think in Bristol specifically, they're implementing a robot where they can essentially do a patient checkup by themselves without the need for a doctor. Um, but also social care, aspects of social care and caring for individuals who might need assistance can be done by a robot. For example, I saw this robot that basically comes from the ceiling and it helps a patient grab onto it and allow them to stand up, which is something that a nurse could do. But having a robot there um, can kind of, I don't know, improve costs, reduce the amount of workload that nurses might have to do, and in reality make it more efficient later on. I mean, part of it is like the idea that uh, what we're moving forward to is a whole different form of healthcare, because healthcare in general is holistic. We're not just caring about whatever patients are experiencing. We're thinking about their whole background and experience with their jobs, their families, whatever. And I think a big disadvantage with the technology that we're using is that it doesn't really consider everything holistically. It considers
Mm.
general um, medicine to be very upfront, like kind of giving the information to a patient, but also reducing that whole patient-doctor interaction that we have and we've seen through and throughout. So I think there's definitely advantages. I mean, Arjun, do you want to touch more on the disadvantages of healthcare? Or in sorry.
Technology in healthcare.
Yeah.
So it definitely forces over reliance on the technology, but overall reliance on technologies. But I think it also there's over reliance on there's over reliance
Yeah.
on technology definitely.
Hmm.
Some other disadvantage of like using technology is like depends on where you are in different parts of the world. So if you're closer to like places that have higher services, so like for example, internet connection that could improve your like interaction with technology along with like how fast you can get your treatments.
Mm.
So
Hmm.
yeah, and some other disadvantages are like if you're like Aaron said, if you he talked about like robots being helping elderly, so there would obviously be a lack of human touch to it. So the patient physician relationship won't be there, and so I think this would definitely have like an effect on the mental state of the patient. So
Mm.
yeah.
Hmm.
Mm.
Yeah, that's definitely true, because I was thinking the same thing as Arian was talking about, sort of a robot helping to lift up a patient instead of a nurse. It kind of removes the emotional attachment, and sort of um, a big issue with the elderly and care of the elderly at the moment is to do with loneliness, because they feel that they live alone. Maybe they live in the rural parts of the country, and they don't their family, it doesn't live with them, or they don't have access to transport, so they do feel quite isolated, especially in a pandemic. And then giving them assistance through the means of a robot, it doesn't make them feel like they've been, kind of helped emotionally, because obviously they have physical needs that we have to cater to. But at the same time, when you're dealing with vulnerable patients,
Mm.
you also have to consider the emotional aspect, because that's obviously the holistic approach. So yeah, it does remove empathy, like Arjun said, and it gets to the point where we think, well, where do we draw the line between like having a human help you and having a machine help you?
Mm.
How do you differentiate between like the clinical need for either one?
Yeah, I think it's best not to not to go too deep into that question. It's very, very broad in the sense that we're getting a lot more advanced with how technology is caring for patients better than humans, like chatbots, for example. Like they completely emulate the empathy that a doctor might provide by itself, which is scary in itself if you think about it, really. But I think another disadvantage is what I've read about in terms of artificial intelligence. There was a case from the Royal Free London working with Google DeepMind, and which is an artificial intelligence software company, and basically there was a leak of I think around 1.9 million uh, data data profiles for different patients. And if you think about it, technology, the way we interact with technology, all clicks and whatever we do is different forms of data that they could use on you. Like we all know about the fears of technology listening to you for adverts and things like that. But
Yeah.
regardless of that, that's all different data that they can use on you and confidential data that they really can't share with other people. And I think making it more technologically advanced would therefore create more data protection problems if you think about it.
Yeah.
Yeah. But
Hmm.
on top of that, I think I think we've touched on like all the advantages and disadvantages throughout the podcast today. Really, if you think about it, well, like throughout the whole thing, we've talked about the efficient healthcare systems, the accessibility of healthcare, the prediction of diseases through preventative medicine, and analysis of healthcare data and improvement of healthcare itself. But we've looked at all the disadvantages too. But I think quickly before we end the podcast today, we should talk about the ethics, right? Ethics is such a big
Hmm.
thing that we need to talk about when it comes to a topic like this. So, yeah, does anyone want to talk about the ethics of technology in healthcare?
Well, there's so many things that come under ethics. I think, yeah, there's some things that I've read about from my EPQ,
Hmm.
which are slightly related to ethics in terms of um, like do no harm and sort of that, non-maleficence aspect. So my research is related to virtual reality, and there are some certain methods of using virtual reality, such as exposure therapy. And that is something that, has been proven to be effective for many, many years. But adding the aspect of technology creates sort of new issues of possibly causing like dissociation. So sometimes with vulnerable patients, or anyone really, if they are exposed to technology for too long, it kind of messes up their sense of reality,
Hmm.
and they become more they lose their sense of self, they lose their sense of their surroundings. And in that case, you really do think, what is the benefit of implementing this when it could be causing them more harm? And so that's one ethical aspect that they're trying to minimize, is through research, is figuring out ways to make sure that technology doesn't, sort of reverse and cause more harm to the patient. And another thing that I researched was about cyber sickness as well, which I don't know if that could be applied to all aspects of technology, but in these more sort of intense, sort of immersive ways. there are some side effects to think about, such as sort of worsening health issues that may not have existed in the patient before. So yeah, that's definitely non-maleficence, which is what I've just spoken about. So that's one ethical aspect that I've recently read about.
Yeah,
Yeah.
definitely. We're touching on the ethics of everything. And okay, last question, right? A rhetorical question for the audience listening to in today. If we employed a healthcare system which had technology, right, where a doctor, let's say for example, were prescribing a patient, a robot, and the robot makes a mistake, and eventually the patient deteriorates and their healthcare is in a worsened state. Who is to blame in that situation? Is it the doctor?
Mm.
Is it the AI engineer? Or is it the company that provides the medical equipment? Is it the machine itself? How can you scrutinize a machine and put the machine on trial? It's really a lot of things to consider here. So I think that we we don't have to answer that one. We can leave that for the audience to think about.
Hmm.
Hmm? Okay.
Yeah.
Any final remarks, guys?
Not much to say, really. I think we've sort of summed it up throughout the whole conversation. I think there's so much more we could say, but
Hmm.
it's like a rabbit hole. So I guess yeah, that's a good way to end it. But we will put all the publications that we've mentioned in the description if people want to read further about it, because, like I said, there's a lot to learn from this.
Mm-hmm. Arjun, anything?
I don't have anything much to say apart from that. Technology in medicine is a very interesting sector of medicine. Everyone should have a chance of researching by themselves, since it's an important factor in like the future years. So yeah, enjoy reading it, I guess.
Mhm.
Yeah, and with that, thank you for listening to episode 4 of Play It By Ear, and we hope to see you soon for episode 5.